Welcome back, everybody. This is part 2 of the NSSI, non-suicidal self-injury or cutting. One of the common treatments that you're going to find out there for NSSI is DBT. DBT stands for the Dialectical Behavior Therapy Program. It was something started back in the late 80s for the treatment of borderline personality disorder. And not everybody who cuts meets the criteria for the personality disorder known as BDI, borderline. But in many cases, it's, the shoe fits and you have to take a look at it. Some of the symptoms of borderline personality have to do with the individual first struggling with their ability to manage their emotions, a lot of manipulative behavior, there is cutting involved, there are feigning of suicide. There's a lot of issues related to relationships, so there's always turmoil among relationships. And these individuals, usually female to about an 8-to-2 ratio, will create a lot of drama in the lives of their parents and the lives of their friends. And most of the time, they're really struggling with relationships, and that's the dominant symptom. The cutting part is actually used to manipulate others, or in many cases with borderline, these individuals are just simply unable to regulate their emotions. Now, we talked about that a little bit in the last video. So for this video, I want to talk a little bit about what type of format is involved in DBT. DBT actually uses the group therapy format most of the time, but you can do DBT with a one-on-one therapist. Therapy, it will involve identifying first the individual's life situation. A lot of times in situations in which you find individuals cutting themselves, they have a very tumultuous home life. Sometimes there's a parent that's abandoned the family. Sometimes there's constant fighting, alcoholism. Sometimes there's a very manipulative parent involved. The other thing that we do after assessing their family life situation is that we move to really identifying what their maladaptive thoughts are, or their feelings, or their behaviors. So we're always looking at behaviors, emotions, and thoughts when we're dealing with therapeutic issues. Therapeutic issues for individuals who cut are usually around the idea that they can't seem to manage their emotions, thoughts, and feelings. Emotions, thoughts, and behaviors. So the individual is, you work with the individual identifying where their thoughts go, where their feelings go, and what sort of behaviors they're doing to actually manage it. You'd be surprised some of the things that actually go on with folks who cut. They will have the most condemning thoughts for things that are generally benign. Then we teach problem-solving techniques. Methods to actually capture their thoughts, methods to actually utilize, thought-stopping techniques, or at least identifying, becoming aware of perpetual thoughts in order to resolve those or change those. Other skills that are important are behavioral skills. These are self-management techniques. Maybe that would include meditation, maybe exercise, maybe getting involved in a hobby. These are some of the things that are done in treatment. We have actually an individual here that actually works with girls who are struggling with these types of behaviors. She uses a lot of mindfulness techniques. Those are very helpful. That includes the meditation, but it also includes other types of mindfulness. It's not just sitting in a chair and meditating, but it's also using other techniques. A very effective tool to also help is hypnotherapy. We also provide that here at our office at Trinity. But we also want you to know that some of the best therapies that are going on out there is dialectical behavior therapy in the group therapy format. So take a look at that for your daughter or for your son who may be struggling with cutting. And if you have any questions, please feel free to call our office. Thank you.